Hey, welcome to Connecting the Dots with Cyril. I'm here in Baltimore. It's Thursday, and a lot was going on today. There's the big issue with the government and the governors and how we're going to restart the government and all of those other things that's going on. But there's another thing that they were talking about that's really been sort of getting to me, and I know it's from a personal level, but I like to tell you what it is. So, I think I saw today they said that 56,000 Americans have recovered from COVID. And I never really hear them say how and what it looks like to recover from COVID. So I'm going to tell you something. In March, probably around the 11th, 12th, I was feeling really bad. I thought I had a cold, and I thought it was going to go away, and I was feeling really bad. Some days I was really tired and could barely get up, and then I would force myself, and then there's other days that I was more energetic. And so what finally happened is one day I went to get up, and I couldn't get up. It was a Friday, and I literally couldn't lift my head off of the bed. And I think I texted my boss and said I wasn't coming in. And I did not wake up again. And I think that was like 5 in the morning, 6 in the morning. And I didn't get out of the bed or wake up again until like 8 o'clock that night. And when I got up, I was lethargic. I could, my throat had that hum. I was, and I was, breathing a little rough. But I still hadn't put this together with the coronavirus. I was still just thinking I had a cold. And so the next day, Saturday, it was a little worse. And the next day, Sunday, it was a little worse. I was planning on going to work on Monday. I woke up the same way. I could barely move. I texted my boss. I said, I'm not coming in today. And she finally called me late on that afternoon. She was like, so what's going on? I was telling her. She said, call your doctor. And I called my doctor. And I started telling her, I said, I probably need to come down there and get checked out. I was running low fever, like 100, sweaty, chills. And at that time, they didn't know all the symptoms of it. So I was telling her I had a headache that wouldn't go away. My eyes was hurting. I had a ringing in my ears. It was a lot more than just, and I had the band around my chest and it was tightening and it was hurting. And my breathing was getting, so weird. And I was also beginning to stir off, like stir off, like my mind would wander and get fixated on something, and I would be staring at it, and I would look at it, and I realized I've been looking at something on the wall for like 3-4 hours and not catching that's what was going on. So I told my doctor all that. She said, well, those aren't the symptoms of it, and told me don't come down there. She would give me some amoxicillin. And so she gave me 3,000 milligrams of amoxicillin to take a day, an asthma pump, and some medicine for the cough. And pretty much that's what I took. No one took my blood. No one. When I called back that week, later on that week to check with her, I was still having the symptoms. And she was like, well, and one day I called down there because I really thought I was going to die. I had been in here. My son was up doing something else with his mom, who's sick with cancer and really ill and terminal. And he was taking care of her. And I was in here alone. And I was in that place where if I blinked, I was tired. I don't think I had eaten at all that day, and I don't remember even drinking water because if I drank water, it made me tired. So I think I was just sitting in I got a new lazy boy, and I think I realized I had been in that chair for almost a whole day without even realizing that I hadn't moved. And my breathing got tight, and I was like, you're gonna die in here, and no one's gonna know you're dead, right? And I called my doctor, and I was like, listen, I need to get in there. And they wouldn't let me in. They told me, I wasn't sick enough and, just keep doing what I was doing. So here's the recovered piece that confuses me when they're saying that. Because, I got better, but I'm not better, right? So 2-3 weeks later, I get headaches that's so severe that I take aspirin. I got all kinds of aspirin, and they don't even knock it out. I even take migraine aspirins, and they don't knock it out. My internal temperature clock is still off. One minute I'm hot and sweaty. The next minute I'm cold. The next minute I'm hot again. My breathing still, my lungs aren't working the same way that they was before that illness. And And there's different things like that. Some days I have energy. Other days I barely want to move because I'm so tired. My appetite is really just shot to crap. You know, I'm forcing myself to eat and drink, even 2-3 weeks later, right? So when they keep saying recovered, I'm getting lost with what does recovered from COVID look like from a guy who no one's tested me for COVID. It's 4 weeks later and no one's ever tested me. And I know I'm not the only one because on this paper here, I have lots of us who have been sick in our homes, who they told us not to come to the hospital and that we should be better. So the first thing I want to read to you is this. And this is an update from recovered patients testing positive for traces of the virus and raising concerns about CDC guidelines. And this was from New York 5 days ago off the New York CBS local news. And what it really talked about, it says, a Long Island mom, and I won't say her name, was one of the New York's earliest coronavirus patients, is now among the first plasma donors. I'm fully cleared of the virus. I have the antibodies in my system, the person told CBS's Carolyn Gustav. And she founded the Survivor's Corps. But then there's another lady who recovered and followed the Centers of Disease Control and Prevention's criteria to discontinue isolation. And when she tried to donate her plasma, she tested positive again. And I was told that I needed to still isolate, she said. And after being asymptomatic for 2 weeks, trace virus cells were still detected. And she was advised if you sneeze, you could infect others. 2 weeks later, the doctors advised her that if she sneezed, she could infect others, right? And so that's raising the concern in the survivor community, like me. Does the CDC guidelines go far enough, right? And because they're telling us stuff, and we're connecting with our kids, we got our spouses back, and we could be infecting them without knowing it, right? And so Dr. Lon Solomon, Chief Medical Officer at the Pro Health Care, told Gustav, the traces of the virus do not necessarily mean the person is still contagious. You can be infectious when you're sick first 8 days, fever, coughing. Virus shedding can continue even though we're not sure as you go further and further away from your acute illness how much infectivity that virus shedding still has. Wow. So that's why the doctor says it's very important to cover your face and practice exceptional hand hygiene within the first few weeks of recovery. He says the science is not yet definitive. So right now it's a little bit vague, and the teacher is better safe than sorry. So be careful. You can still have this thing in you, and you can still be infectious weeks later after they claim that you have been recovered, right? And there's millions of people like me who the hospitals wouldn't take and who got better in their own home. And really it's just, in my estimation, it's got to be God. Either this, you get hit well, this one doesn't, or whatever, because there's no medical definitions for what the treatment is for the coronavirus, because there is no treatment. So what did you do to help somebody get recovered? So let's go. Here we are. Here we are, America. Here we are, world. Let's go, because this ain't just America, it's the world. Let's go. So the CDC for COVID-19 guidelines for recovered patients. CDC meaning the let's get right there. So let's get right to what they're talking about, the CDC, right? So the CDC is who governs what we do and how we act in any crisis medically, right? So it says the guidelines for recovered patients, right? It says discontinuation of the empirical transmission-based precautions for patients suspected of having COVID-19. So this is what the decision, how they discontinue or decide that you are recovered. And this is based on the FDA's emergency use of authorized COVID-19 molecular assay for detection of SARS. Man, that says a whole lot to say they don't know shit. So let me get to where the problem is. It says If a higher level of clinical suspicion for COVID-19 exists, consider maintaining transmission-based precautions and performing a second test for the SARS-CoV-2. If the patient is suspected of having COVID-19 is never tested, the decision to discontinue transmission-based precautions can be made based upon using the non-test-based strategy described above. The non-test-based strategy described above. So they're saying that if you never went to the hospital like me, you never got tested like me, that they can, based on some non-test-based strategy, decide that you are now recovered from COVID-19. Did y'all hear that? This is our federal government's decision on the criteria. So I want to read to you what they are using as the definition for getting well. So the CDC says you have to be this is going to be crazy. So the person has to be absent from having a fever and having a fever of not having a fever after they have not taken fever-reducing medication for 3 days, right? At least 3 days, right? Then they have to have improved respiratory symptoms, i.e. the cough, shortness of breath, and all of that should have went away, and at least 7 days have passed since the first symptoms appear. Then they give them a test, and then 24 hours later they give them a test. And if you pass these bullshit criteria, 3 days without having a fever reduced because you didn't have to take fever reducing medicine, right? Bullshit criteria. And then along with the 3 days of not having a fever, you have to have had another 3 days or 4 days of not needing medications to improve your respiratory symptoms, shortness of breath, or cough. And then after 7 days of not exhibiting any of those signs and symptoms, they'll give you one COVID test, and then 24 hours later give you another one, and then you are deemed recovered and free to go about back into the world. And that's the guidelines they're using to want to reopen the country right now. When we haven't tested 10% of the population. Not 10%. And if any civilized country was to use that guideline in a disease of this magnitude, it said for people who have never been tested, that means you were home, you got sick, and you got better, then they will make this decision based on the non-test-based strategy described above. I don't even know what was described above because I read everything to you and it made no sense to me. But okay. Because it says if a higher level of clinical suspicion for COVID-19 exists, consider maintaining transmission-based precautions and performing a second test for SARS. If the patient suspected of having COVID-19 is never tested, the decision to discontinue. So how are you going to discontinue something that you never tested us for anyway? That makes no sense. The majority of America has gotten sick and never been tested. And we already heard from the first article that the people are becoming asymptomatic and also able to pass the infection on after the acute symptomology goes away. So here, let's read this one. I'm still with you, America. I got to help you out before we make a foolish mistake. This is from an article on April the 1st, 2020, right? After recovering from COVID-19, patients struggle to know when to stop isolating. And guidelines are based on the limited data available. Right? So here we go. A person says they're feeling better. After cycling through the illness, she thinks she was COVID-19. Thinks, because nobody tested her. Nobody's ever tested her. Thinks she was COVID-19 with headache, fever, nausea, and her symptoms started to subside. But she lives in Brooklyn, New York with her husband, who's still sick, and her young kids. And it's getting harder to schedule grocery delivery because the stores are slowing down. So there's a store around the corner, but she says she's still struggling to figure out when it's safe for her to leave the house without infecting other people. Everyone has a doctor, friend, or relative who's going to tell you different things, she says. She's heard that she should wait 7 days without a fever, or 7 days without any symptoms, or even as long as 40 days. The new coronavirus is spreading through the U.S., and several states have made emergency declarations. The World Health Organization has declared it a pandemic, and here are the basics. Right now, the Centers for Disease Control and Prevention, CDC, says that people can stop isolating if they've been fever-free for 72 hours, and their other symptoms have improved. And it's been at least 7 days since they first felt sick. The CDC's guidelines for being recovered is the person can stop isolating if they've been fever-free for 72 hours. Their other symptoms have improved, and it's been at least 7 days since they first felt sick. The limited information available on how patients recover seems to support those guidelines, says James Hudspeth, the COVID response inpatient floor lead at the Boston Medical Center. But the other patients are still facing conflicting information and advice because there's still no clear data showing how long people who get COVID-19 are contagious. There are a lot of questions left unanswered, right? And it says, doctors still don't know much about how the virus, enough about the virus and how it affects someone else. But they generally feel that if a person has lower levels of the virus, the chances that they're contagious is lowered as well. That data has made us feel more assured about the CDC's guideline, he says, and it's reasonable that they will capture most cases and make sure most patients are cleared to a reasonable degree of health. I'm going to stop reading that. Because if you continue to read this, you should be deathly afraid of the Centers for Disease Control ability to manage and figure out what to do with COVID-19. And people like me who are supposedly recovered but never been tested. So we work on the non-test based method strategy of prevention. But I like what one person said. It says, the shape-shifting nature of the illness makes it hard to track. COVID-19 has a shape-shifting features to it. Like I said, they didn't even know all of the symptoms when I was telling them in early March. And my doctor was saying, well, those aren't the symptoms. I said, okay, well, I don't know. But now we hear they are the symptoms. We're also hearing that COVID-19 can also cause strokes in people who have recovered and who are going through COVID. Because they're saying we're coming out because I still have the brain confusion a little bit that goes on from what happened when I was starting off. That's still there. And they're saying that those are considered brain stroke seizures. Now, there's another feature to this that's really scary. They're saying that people with COVID-19 can experience heart attacks if they have heart conditions. And they'll die from the heart attack, which is conducive upon having COVID-19 as the primary cause. We need some help. We need some clear guidelines in what's going on. We need some clarity before we begin to reinfect this whole country. And I keep putting out the pandemic of 1918 on my Facebook so people can understand it came in 3 waves, right? It came in the spring of 1918. It died down. It came back in the fall, and it was even more dangerous and killed more people. Then it came back in the winter, and it killed more people. And then it came back in the spring of 1919 and killed more people. So, Alexia Wagner, Assistant Director of Adult Emergency Medicine at the Stanford Department of Emergency Medicine, also says he's largely following the CDC guidelines with some exceptions. Sometimes it's easier to just tell people 7 days since their last symptoms, he says, and that's a more conservative interpretation of the guidelines. Relying on symptoms can be challenging because the illness caused by the coronavirus can come and go. We haven't tested 10% of the people in America right now. Not even the first test. Not even those who have recovered. Right? We don't even know what recovery looks like. We have no idea what it looks like. So every time I hear them saying 60,000 people have recovered and they're clapping and and I ask a simple question, so what did medicine do to help them recover? What was your procedures, your protocols? What medications did you give them that we could probably re-give somebody else to make sure that what we did actually worked? And pretty much, it's we just throw stuff at the wall, and some people get better and others don't. I'm done, America. I'll catch up with Carlos tomorrow and put that show on about the methadone. But I'm done, America. I gotta rethink this. I haven't been outside but twice since I got sick. I'm definitely afraid of being around other people because not even so much about me giving it to them. I'm afraid they'll give it to me, and I do not know what a second bout of this will look like. You know, because the first bout was enough to terrify me. So I definitely don't want a second go round with this beast, right? So I'm like just hiding out. America, you take this information, you connect the dots, the world, you do it to connect the dots, you do what you need to do with this and begin to make decisions. Do not make decisions based on that clown information of, a person has to be fever-free for 72 hours without having a fever-reducing medication. 72 hours, 3 days. And then they must not exhibit any other symptoms, cough, nausea, or anything for 7 days, and then take a test. And then we know half the tests in America are bullshit. They don't work. Take a test, and then 24 hours later take a test, and you're considered recovered from the coronavirus, and you're free to move about the country. That's the CDC's guidelines for recovery from the coronavirus. You make a decision about your health and your safety and your family, right? Because that's not enough data to make a really earnest decision about how to move forward in this. And they keep touting this, so instead of finding good medical treatments, instead of finding good medical things that we can do to combat this thing. So we keep playing at this and keep wanting to rush something. And I'm telling you, there are more people in the world and in the United States today than there was in 1918. And they said that the deaths in 1918 was more than all the lives lost in World War II and World War I combined. And that was in 1918. Combined. Imagine what's going to happen now. Check me out tomorrow, man, on Connecting the Dots with Cyril. See you later.